Bismillahirrahmanirrahim. Assalamu alaikum. My name is Danish Bawa. I am a graduate of Karachi Medical and Dental College of the year 2013. Before I formally introduce myself, I would like to say regards and thanks to Dr. Bushra, Dr. Sharjila, and the entire team of KMDC Alumni Association. And I would like to pay special tribute to Irfan Bhai for providing us this vision of establishing KMDC Alumni Association, and I would pray may his soul rest in eternal peace. So coming to my introduction, as I just mentioned, I am a graduate of the batch 2013, and I have had 3 years experience of practicing medicine in Pakistan while working as a house officer at Aga Khan University Hospital. In 2014, I have worked in Patel Hospital in the ICU setting for a year as an RMO, and then I did 1 year internal medicine residency at Aga Khan University Hospital, after which I decided to move to United States, and I have worked as a postdoctoral research fellow with DeBakey Heart and Vascular Center at Houston Methodist Hospital for 2 years, and recently I have started my internal medicine residency at Louisiana State University. So that's my brief introduction, and I was asked by Dr. Bushra to give a brief overview of the USMLE journey from starting to the beginning. Obviously, it's a very long topic, and in the interest of time, I would like to just highlight on the most important things and take you through the journey superficially and not going into the great details of everything. So, first of all, let's talk about what are the merits and demerits of practicing medicine in the US, and what are the challenges. So, merits of practicing in the US is that it's definitely the most advanced country in the world in terms of technology. So you have the best available resources here, and you have the literally the best training in the world, and then you have the opportunity to be able to practice in any part of the world after you have acquired your training in the US. So these are the these are the advantages, and definitely there is a financial aspect of it as well. Doctors in the United States get paid extremely well, so they can look towards the future with confidence, and they can have an extremely good quality of life. Talking about the demerits, definitely you are far away from your country. You miss your country, you miss your family, you miss your friends and family. Uh, Another thing would be you have to practice defensive medicine, means the litigations and the fear of being sued by the patients is a lot. So you cannot do as much good for the patients as much as you want in US, because you have to always think about saving yourself first. That's not the case in all the situations, but you have to be careful about it, and it can literally end your career. So that's the challenge. And another thing is that there is too much documentation. So uh, nearly half of your time in the US is spent in typing notes and documenting the care you have provided. So these are a few of the challenges of practicing medicine in the US. Again, the visa and the cost is also another thing which is a barrier for a lots of people. So this is a brief overview of the merits and demerits. Let's talk about the whole journey and the process. What are the exams you have to take? How do you apply for residency? The US clinical experience, and then ultimately we will talk about how to get into residency. So the overall process. So there are 3 exams which you have to take before you are able to apply for residency. The first exam is USMLE Step 1, second is Step 2 CK, then Step 2 CS. So Step 1 is the exam which focuses mostly on the basic sciences like anatomy, physiology, biochemistry, genetics, pharmacology, pathology, and behavioral sciences. So The resources for step 1 are USMLE first aid. You can use the Kaplan lectures, you can use the Dr. Najib lecture videos, and UWorld is definitely a resource. You have to take that, and then you have to take the self-assessment and NBME exams before you appear in the exam. It's an 8-hour long exam, and you can take it in Pakistan. You don't have to come to US to take that exam. The cost of the exam is roughly around $895, or you can say $900, and it all depends on the rate of the dollars in Pakistan, how much it would be in Pakistani currency. Uh, few of the challenges which most of the Pakistanis face in terms of step 1 is the behavioral sciences and the genetics, which is not very well taught in our curriculum. So these are the things which you will definitely have to focus a lot on while you are preparing for step 1. And then uh, biostatistics is also one of the subjects which is not very heavily taught in our curriculum. So these are the challenges, but overall step 1 is considered as one of the most toughest exam out of all the other USMLE exams, and it's very important to score good in the exam. It's not a pass and fail exam. You have to score good. You have to score in the 95th percentile, so you have a good chances of getting into residency. Not saying that if you haven't scored good, you cannot get into residency, but it makes your life a lot easier if you have good scores. Now coming to USMLE Step 2 CK, it's, as the name indicates, it's the clinical knowledge exam. So you have to focus on the clinical subjects like uh, medicine, and the allied subjects like cardiology, pulmonology, critical care, surgery, and the allied like urology, neurosurgery. And then you have to study obs, gynae, pediatrics. So these are the subjects which are tested in the Step 2 CK exam, and it's recommended, or it's best if you take step 1 before step 2 CK, because it provides you with a basic platform to solve the questions you will encounter in step 2 CK. But usually for majority of the people I have talked to, they consider step 2 CK exam as easier than step 1, and step 1 definitely helps a lot in step 2 CK. The cost of step 2 CK is again $895. The price in US, in Pakistani currency, will vary based on the price of the dollar, and you can take this exam in Pakistan. You don't have to travel to US for taking this exam. uh, the third exam is USMLE Step 2 CS. You have to come to US to apply and to take this exam. It's kind of a, I would say, 9-hour long exam. You have 12 stations, and you have to encounter with the patients and talk to them and provide counseling to them and write notes for the patient encounter you have had. So this is a very easy exam for the American medical graduates, because that's all they have been doing in the medical school. But it is one of the toughest exams for foreign graduates, because first of all you have to go through the process of visa application, which is a challenge, and then you have to get adapted to the US healthcare system. You have to be able to talk to the patients fluently in English, and you have to be able to understand their complaints easily, because sometimes I have seen that patients get frustrated when doctors are not able to understand what they are saying. So English fluency is definitely important for this exam. There are a couple of resources available for preparing for these exams. I would briefly highlight some of those, and then I would go on the next slide. So the resources available would be, there are some private tutors who give tuitions in person. There are some private tutors which who teaches USMLE Step to CS over the Skype, and you can always use the for professional exams. Those are professional trainers which are very expensive, but it's available. The centers which are considered as favorites or as friendly for IMGs are Houston and Chicago. Okay, let me see. Okay, So the cost of USMLE Step to CS is around $1,550, which is roughly around 2,70,000 rupees based on the current dollar prices. It can definitely vary, and you have to apply for the US visa, the fees of which is around $160, and then you have to pay for the flight tickets, you will have to pay for accommodation. So it's the most expensive exams out of all other exams in terms of revenue. So be prepared financially if you are planning to take the this route. So once you have taken all these three exams, you will get the ECFMG certification, and you are able to apply for residency after you are ECFMG certified. Few clarification here. First of all, I just mentioned that three exams: step 1, step 2 CK, and step 2 CS. It's not necessary to take the exam in the same sequence. You can take any exam first based on your convenience and your preference. You can take step 2 CS first, and then CK, and then step 1. You can take step 2 CK first, step 1, and then step 2 CS. So there is no hard and fast rule that you have to take certain exams first. And secondly, I just said that you are able to apply for residency once you are ECFMG certified, but you can still apply for residency even though you are not ECFMG certified. I have seen a few people applying for residency without taking step 2 CS, but your chances of getting interviews and getting into the programs are low, and then you are required to be ECFMG certified before the results of the residency, before the match. So it's preferable to apply after you are ECFMG certified, but it's not an hard and fast rule. So that's a brief introduction about the exam. Now coming towards how to get into residency. So there are certain things which are required for every candidate to be able to get into residency. So first of all, you have to have good scores in all in the first two steps, and you have to, usually it's recommended to pass it in the first attempt. I have seen people matching with second attempt too, but it decreases your chances of matching significantly in the CS. And for step 1, step 2, it's recommended to have scores in the 95th percentile or above 95th percentile. I'm not quoting exact numbers because 95th percentile varies over period of time based on how average American graduates and foreign graduates are performing in each of these exams. So first thing for residency application are definitely scores. The second thing, you have to have US clinical experience. Now that's another big challenge for the medical graduates. There are two types of US clinical experience, or I would say three types. First is called clinical electives. Clinical electives can only be done while you are a medical student and while you are enrolled in your medical school. So you have to take a no objection certificate from your medical school, and you have to have a supervisor approving your visit to US, and then there you have to be able to travel to US definitely. And what's the difference between a clinical elective and an observership? So a clinical elective students are allowed to talk to the patients, to touch the patients, and to even to be able to write the notes while as a student note while you are working with a supervisor under supervision, versus an observership can be done after you are graduate from your med school, and then as an observer you are just there to observe. So you are not allowed to touch the patient, you are not allowed to talk to the patient, you are just shadowing the attending physician. So definitely elective have an advantage over observership. The third form of clinical experience is externship, which is really hard to get. And externship is where you are actively involved in the care of the patients under supervision. So these are the three types of US clinical experience, and each of these cost a lot. Like I have seen people paying as much as $2,500 for one rotation, and on the other hand, I have seen people doing rotations for free too. So it just depends upon how smartly you navigate through different options available and how smartly you use your contacts in the US. So US clinical experience, you have to have at least two letters from the US, one letter from the your home country could be acceptable, but it's best if you can get three rotations and three letters of recommendations, which will increase your chances significantly. So you have to submit at least three letters of recommendation, and maximum you can submit four. So if you have four rotations in the US, that would be the best. After US clinical experience, you have to have a really good personal statement. So personal statement is something you submit while applying for residency. So you have to use, I would recommend you to use professional help, or at least use the help of someone who has been in the US for a while, to look over your personal statement, because it's the first impression any residency program would get about you while you're applying for residency. Third thing would be the MSPE, which is called Medical Student Performance Evaluation, which is something you get from the medical school. A lot of time you get a dean's letter, and that dean's letter is not useful at all for the residency. So I would recommend to get MSPE. I have given the updated version of MSPE to Asif Bhai, and you can write as much good stuff about yourself in MSPE and get it signed by the principal, so you uh, are able to at least support your application in terms of MSPE. Last and not the least, the important thing while applying for residency is your CV, or how you fill out your residency application. So a lot of people underestimate the importance of your profile and your CV while applying for residency, but it's really important, because that's also one of the first impressions program get about you. So be very smart and try to be very particular about the stuff you have done in your application. Like if you have worked with hopes, or if you have worked with any other NGOs, try to describe your duties and the role you have played in that NGO. Don't just write that you have done this thing. So, and if even if you have to exaggerate it a little bit, you can exaggerate, but don't take it to the extent where anyone can judge that it's just faking it. You have to be very smart in filling out your application. Now, coming to the residency application itself. So you have to submit all your residency applications through a portal called ERAS. It's called Electronic Residency Application System. You submit all the documents in ERAS, like the scores are submitted automatically. You have to submit your personal statement, you have to submit your MSPE, which has to be submitted by the medical school directly, and you have to submit your applications, and then you have to submit your letter of recommendations directly from the supervisors you have done rotations with. Coming to the cost of residency application, a lot of people, or I have seen majority of the IMGs apply to at least 150 programs, and the way it works is that for the first 10 program you apply, the fee is $100 for the 10 program, and then it's $12 for the program from 11th to 20th program. It's $16 from the 21st to 30th program, and every program you apply after 30th program, it's $26. So roughly, if you are applying to 150 programs, it's gonna cost you at least around $4,500, and then you have to pay for the ERAS token, which is available around July, and the application process opens up around September. You have to appear in interviews throughout this season between September to February, and then the match day is usually the second Monday of March. So that's all about the residency application. There are few nitty-gritties and few details about how to get good interviews, what are the tricks, which are beyond the scope of this presentation right now, but you can always reach out to me personally, and I will be more than happy to help you out. Uh, Let me think if anything else is left. I think I have covered most of the things. I have given my contact information, my LinkedIn profile, my Facebook, and my WhatsApp number. You can contact me anytime, but try not to call directly. Send me a message, and I will try to answer your questions at my earliest convenience. And if it's a long discussion, I'll definitely call you at my uh, first available time. Thank you so much. It was a pleasure talking to you guys. Have a good day.